Hello everyone, this is Emma from Ultrasound. We are talking about the hot cell black-white ultrasound WED9618. Here we have 3 topics to share with you. The first one is how to start the machine. The second one is how to operate it. And the last one is how to connect a printer to print the report out. The first topic, how to start it. When you get the machine, you will have the main unit, the probe, maybe 2 probes, it depends on you, and also the electric plug. Let's turn around this machine. You can see there are 2 probe connectors and 3 ports. This is BD port, USB port, and RS232. Also, there are 2 probe holders here to support the probe. And in this side, you can see the power button and also the start button. Before starting the machine, let's get through the electric power. And then we have to connect the probe. For this probe, there are 2 sides. This one and this one. You see the differences. In this side, there are 4 screws. This is very important for you to connect the probe correctly. So pay attention to these 4 screws. The side with 4 screws must towards the ground. Otherwise, this machine can't work or the probe is broken. This way. The side with the 4 screws towards the ground. Then turn the button clockwise. The probe is located. Otherwise, if you want to unplug this probe, you have to turn it counterclockwise. And let's put the probe on the probe holder. Before we use this machine, we have to turn it off. And also turn this blue tab to start this machine. We have to press 2 buttons. First, turn on the electric power button, and then don't press the start button. The next, we press any keys. Go to the scanning mode, and if we want to turn off this machine, we have to press this button again. Start button at first, and then press the electric power button. Now it is closed. The topic 2 is how to use this ultrasound. At first, we have to fill all the basic information of the hospital and patient. press annotation, there will come a menu with numbers about them, patient ID, sex, and any other information. Then there are two ways to type the related information. Let's say the first one, number 1, name. You can just press the number 1 and type the related letters. After finish it, press confirm to exist. And also you can choose another way with the moving with the trackable annotation, and we can use the trackable to choose the one that you want to type, like say number 2, patient ID, then confirm it and type. After finished, just confirm. So after you scanning the patient, we want to go to the new patient. We only need to press new patient here, the button. So all the master patient information be cleared. Then you enter the information again with the same way. Now let's go to scanning progress. For this machine, there is one probe. If we have 2 probes, we have to choose the right one that you want to use by press probe S here. There will come out 2 probe choices, and then you go to choose the right one. So for this machine, there is one probe. There are models that you can choose. Here, B model. Press it, B mode, BB model, and BM and M model. Also 4B. For 4B model, we have to pick the B model and then press it. Therefore, B model come out. When you scan in, like let's say abdominal, we add some juice. We are going to scan the abdominal. There are many parameters to adjust. Let's see the 4 knobs here. This is the gain, depth, focus, and the multifunction knobs. Let's say we adjust the gain. We can rotate it. You can see the color is changed. And we can rotate the depth. Also, we can move the focus. And we can press the knob, the multifunction knobs, choose the related parameters we can change. We can change the pseudo cover. There are 7 pseudo-colors options. And we also can move the knobs position. When we move the knobs to the right, to the left, becoming darker and darker. To the right, much lighter. This is control the near field. This is the middle field, and this is the far field. We also can press the up and down to change the image, or left and right press, and we also can choose the Duel and rotate the knobs to get the exact part or image that you want. And we press clear button to exist. We also can add the body marks. There are 40 body marks options, but we have to press freeze first to freeze the image and then add body marks. Press freeze it again to unfreeze the image, and you press confirm, and we can add the indicator with directions. Press before, then you can see the indicators. And before it, the direction of the indicator is changed. If you don't need the body marks, we can press clear button to move it. So let's save the image. We press freeze at first and then press button 7. Save, button save. Then will come the prompt with the numbers. That means for this picture, the name is 11. So if we want to record the image, we press record, and we put the type of the related number, let's say 11, and confirm the image is out. The image is recorded. Normally we can save the 64 images here. Sometimes we need a thin loop to play back the images. For thin loop, it needs around 30 seconds to collect the image. So we have to scan it around 30 seconds, and then freeze it. Press thin loop buttons. This is the thin loop button, and then you can see the past videos. If you want to exist, then press the freeze button. Be back to the real-time scaling model. When we get the ideal image, we press the freeze to save the image, and then we do the measurement. We have distance measurement and area perimeter measurement and volume measurement and cardiac measurement and obstetric measurement. So for distance, let's try press distance and press reform to start the measurement and move the Rechargeable and press V4 again to add the measurement. We can measurement distance for 4 groups. Let's try another one. Press V4 to start the measurement and move the Rechargeable and press V4 again to end the measurement and press enter to confirm it. So this is the distance measurement. Let's back to another measurement. We press clear and we go to the AC area and perimeter measurement. Press AC. There are two ways to measure the area and the perimeters. Let's try the first one. Number 1, freehand. Press V4 to start the measurement and move the Rechargeable and press V4 to end it. You can get the area details here. We can have 2 groups of this AC measurement. So cancel it and we AC first and then V4 and press V4 again and cancel it. So you get 2 groups of the AC measurement. Let's clear it and back to another way. AC, we use adequacy. Number 2, move the Rechargeable to choose the exact part you want to measure, and then you conform and move the Rechargeable to make the sampling box big, sampling window big or small, and press V4 to change the direction. So we try again. Press Ctrl to make it bigger or smaller, and V4. Press V4, then the sampling window direction changed, and press Cancel. Fixed. We can get 2 groups of the AC measurements, so let's try again. First, AC, and then confirm it and rotate it to make the windows big or small, and before it to change the direction of the windows. So let's cancel it. You can get the data here. Now let's back to the volume measurement. Volume measurement, there are 2 ways. The first way is when you get 3 groups of distance measurement, then the volume measurement comes out. Or when you get 2 groups of the AC measurement, then you also have the volume measurement. Let's see. Distance. We have to get 3 groups of distance measurement. Distance. For group 1 and cancel it. Group 2, cancel it, and distance. Group 3, then you see there is a volume measurement in the lines. And let's try another way. Use AC. Let's see 2 groups and conform. Because more than them, we cancel it and another group, and then we cancel. You also have the volume measurement. So these are the ways to measure it. Once we have done it, we need to make a report. So we just measurement finish and press freeze. Press freeze, or you get the report. After we finish the measurement, we go to make a report. There is a report button. We press the button report, and because we will skate the abdomen, so we go to choose the first one, abdomen. And you can see there is a report here. This is the video printer to connect with our black-white ultrasound WED9618. First, we have to get the printer electric through with this electric plug, and then there is a video cabin with the two ends. The two ends are same. One end is connecting with the printer, and the other one is connecting the ultrasound. When you insert the video port, then you rotate the screw to lock the cable, and then we press the power button. Press power button to activate the printer, and then press this button to install the papers. And print the button to print the report out. You also can print the image out. If you want to print the image by printer, you can back to the mode, and then you press the printer button. There is the image out. So that's all.